Good afternoon. Welcome to the weekly COVID media briefing. I will turn things over, as is customary, to Dr. Fitzgerald for her update.
Thank you, Minister. Good afternoon, everyone, and thank you for joining us today. Since the media advisory yesterday, we have no new cases in the province, and our total number remains at 291. 283 people have now recovered, and in total we have tested 51,529 people. It has come to our attention that some residents have received telephone calls allegedly from myself. I would like to advise the public today that I would not make such calls or leave any such telephone messages. So if you do receive a personal call or message from someone claiming to be the CMOH, please don't release any information to them, and contact your nearest police detachment to report it. It is not at all surprising that we continue to see new cases of COVID-19 in our province each week, particularly as many other Canadian provinces are now into a second wave. And while we cannot prevent all new cases of the virus, we can certainly continue our collective efforts to keep our numbers low and manageable. Our public health officials continue to monitor closely the epidemiology of COVID-19, and as things shift and change, so do our recommendations and guidelines. To that end, today I'm announcing some changes to symptom guidance related to COVID-19 testing. Up until now, individuals have had to have 2 or more symptoms of COVID-19 in order to meet testing criteria. Effective Monday, November 2nd, this will change such that individuals experiencing a single symptom of fever or new or worsening cough will meet the criteria for testing. Individuals with 2 or more of the following symptoms will also meet the criteria for COVID-19 testing. Those are shortness of breath or difficulty breathing, runny, stuffy or congested nose, sore throat or difficulty swallowing, headache, loss of sense of taste or smell, unusual fatigue or lack of energy, new onset of muscle aches, loss of appetite or vomiting or diarrhea for more than 24 hours. If you have only one of these symptoms, please stay home until 24 hours after your symptom resolves. I would like to once again thank those who have come forward for testing when they have symptoms. One of our most important strategies for the control of COVID-19 in our communities is the early identification and isolation of cases. If people feel safe to come forward for testing, we will be better able to do just that. It's important for us to remember that nobody intentionally sets out to contract this virus, and when people come forward for testing, it is ultimately to help protect others around them. Let's show our appreciation and support of these individuals through our kindness and compassion. We are truly in this together. Another way we can help to protect one another is to get the annual flu shot. With the ambitious goal of an 85% vaccination rate this year, I encourage everyone to avail of the opportunity to get the flu vaccine at no cost through your family physician, local pharmacy, or a public health flu shot clinic. To make an online appointment at a local public health flu shot clinic near you, please visit timefortheshot.ca or call toll-free 1-833-951-3904. Getting the flu shot will not only help protect you and your loved ones, but it will help keep our population healthy and maintain capacity within our healthcare system should we see a spike in COVID-19 cases. As Halloween is quickly approaching, I would like to take a few minutes today to talk about some public health guidelines that will help keep you and your family safe as you partake in festivities this coming weekend. Prior to Halloween night, please consider wrapping treats in individual bags to help avoid concerns about viruses on the packages inside those bags. While the risk of the virus transmission on packaging is low, parents or guardians may wish to set aside any collected treats not wrapped in individual bags for a few hours. The most important thing to remember is that if you are feeling ill or self-isolating for any reason, you must refrain from trick-or-treating activities. Children should stay at home if they are unwell. If you feel unwell, please do not give out treats. Ask someone else to hand them out for you, or place a sign on your door asking parents and children to skip your residence. And I would ask that everybody please be respectful of all households not handing out treats this year. If you are handing out treats, kindly wash or sanitize your hands and consider wearing a non-medical mask when answering the door. Drop the treats directly into the children's bags rather than inviting children to select their own treats. Children should wash their hands before they leave home, when they arrive home, and before eating any treats. Parents should consider accompanying their children this year to ensure they follow physical distancing guidelines. Children, even older ones, are often so excited on Halloween that they might forget. Please limit close personal contacts by trick-or-treating with people from your own bubble, and maintain physical distancing of 6 feet from others by taking turns visiting residences. Children should avoid entering indoor porch areas when getting treats. While non-medical masks are not required for outdoor trick-or-treating, they may be required when visiting residence or apartment buildings or other indoor spaces. Please keep your children safe by taking them trick-or-treating, wearing reflective materials, watching for traffic, and using crosswalks. We know the risk of transmission of COVID-19 is higher indoors, so if planning to host Halloween festivities this weekend, please remember our mantra of people, space, time, and place. Keep social gatherings within your usual bubble of family and friends. Smaller gatherings lower the risk of transmission, and many of the outbreaks seen elsewhere in the country have been ignited and fueled by social gatherings with extended groups of contacts. Please ensure the number of people invited can be accommodated within your space, and 6 feet of physical distancing is possible between individuals and bubbles. Keep your gatherings short, especially if they are indoors, and have outdoor activities if you can. Kindly remind people to stay home if feeling unwell. Ensure washrooms are well stocked with liquid soap and clean hand towels, and discourage the sharing of food. If food is necessary, individuals or those within the same bubble should bring their own. In advance of Guy Fawkes Night, or Bonfire Night, as we more commonly call it here, next Thursday, November 5th, I would also like to take the opportunity today to remind communities and residents about the COVID-19 public health guidelines for outdoor gatherings. Organizers of Guy Fawkes Night activities are reminded of the 100 people maximum for outdoor events and must ensure public spaces can accommodate attendees by allowing at least 6 feet of physical space around individual bubbles. Residents are reminded they must stay home if feeling unwell. And for additional recommendations and guidelines for outdoor events, please visit the website at gov.nl.ca/COVID-19. As a recap, for those who may have just joined, we have no new cases since yesterday's advisory. The total number of cases in the province sits at 291. As we continue to navigate our way through this pandemic, I would like to express once again my profound appreciation for your efforts in keeping COVID-19 contained in our province. The incredible spirit and determination that runs through our communities not only reminds me of how far we've come, but fills me with hopes and optimism for our future. Together, I know we will persevere. And wishing you all a very safe and happy Halloween. Thank you.
Thank you very much, Dr. Fitzgerald. Well, before I make my comments, I'd just like to recognize it is Respiratory Therapists Appreciation Week. I think maybe I was privileged in that, having had a role as a clinician and a part-time intensivist, I had quite a lot of interactions with this profession within the healthcare system, particularly in acute care. They have certainly come to prominence during COVID, particularly as it presents as an illness involving breathing. They have worked hard and provided stellar service and continue to do so, and are ready in the event that their services should be needed if we are unfortunate enough to see an uptick. This is their week, and I just wanted to give them all, be they in acute care or in the community or wherever they are, a shout out and a thanks from me and from the department and the people of Newfoundland and Labrador. Well, it is day 235. As Dr. Fitzgerald says, we have no new cases and the number of active cases has dropped. Of the issues I'll broach, I think the most topical for certainly a very active and interested group of people is the issue of our analysis of the rotational workers pilot scheme. The report was unfortunately only delivered to my department literally half an hour ago. The analysis is complete, and by week's end, we will be in a position to announce what, if any, changes will be made to that program. Certainly over the duration of the pilot and the analysis period, we haven't seen any concerns that would make us want to reinstate further restrictions for rotational workers in terms of isolation periods or restriction on activities. But again, without prejudging the analysis and the report, we'll continue with that until we have those recommendations public, and that will be before the week's end. One of the considerations, obviously, that plays into any decision about COVID-19 relates really to what's going on elsewhere. And the numbers in Canada are not particularly encouraging at the moment. Indeed, in Edmonton, the case prevalence there is worse in Edmonton than it is in many United States cities. And that number shows no sign of decreasing. There are provinces with now their new normal currently is 1,000 new cases per day. We have had some analysis of other data that shows that our travel restrictions have produced a 92% reduction in the number of cases that we would have seen otherwise. So you can appreciate with the scattered cases that we have seen and the small clusters, if we were to increase that, we would be in a really difficult situation by now. So these are factors that we and Dr. Fitzgerald team discuss on a regular basis in deciding how best to navigate our way through these uncertain times. From the point of view of the focus, both nationally and locally, the emphasis now is on what we call super spreader events. It would appear that around 80% of all infections actually come from around 19% or thereabouts of infected people. There are huge numbers in some jurisdictions that have arisen from this. I think the record, not that it's a really good one, is held by a lady in South Korea who managed to infect 5,000 people over the course of a church gathering. We have had our own smaller version of this in St. John's earlier on. Contact tracing is a key for this, and the current evidence shows that the further back we can go to identify who infected the super spreader, the better our results at containment. And I use this to emphasize the fact that we do now have a tool which will help people's memories. For those of you who were diligent enough to keep a rolling log of the people you met on a 14-day cycle, well done and congratulations. The COVID Alert app, however, on your smartphone is just as good and just as effective and totally confidential. Every privacy commissioner in Canada has agreed that it meets their standards in terms of safeguarding information, and the numbers of people who've downloaded this app slowly increase week over week, and I would encourage you, if you haven't already got it, to be one of those in the event that should you be exposed to an individual, you will know about this because of the options that are available to you through that app. Just as a reminder again about the change that Dr. Fitzgerald mentioned about symptoms. So if you have either a fever or a new cough that's worsening, either of those will trigger a test, and you can call 811 to organize that. The list of symptoms from which you should have two to trigger a test is available online, and I would encourage you to check that. In terms of things we can also do, building on the social distancing and building on the masks and the hand washing and good hygiene elements, it is flu season. And it would be sensible to avoid a disease you can avoid, particularly as flu is a real threat to those who are elderly or medically unwell for other reasons. Timefortheshot.ca will enable you to find an appointment near you and convenient from a time perspective, and is very straightforward for booking. One element which we've received some concern about, and we're working with the software team, is around an email being unique for each appointment. The workaround for those people who are booking multiple appointments is simply to put one email in for the person doing the booking and leave the others who will accompany you blank until such time as we fix that. There is also a notes piece at the bottom when you get there, and you can use that to write some free text to explain that. Timefortheshot.ca. For those people who have challenges with internet, there is a toll-free number where the operator there will enter your data into that program on your behalf and organize the appointment. In addition to that, there are now a lot of local pharmacies who are running their own flu shot clinics, supported by the department and the regional health authorities. And if that turns out to be more convenient for you, then by all means go. Family physicians' offices are available for those who would prefer that, and they, again, should be contacted directly for their arrangements. From the point of view of the flu season, our target is 85% vaccination rate. It is ambitious, but it is achievable. We have vaccine aplenty for the 85%, and this is free. No one should need to pay or be asked to pay for a flu vaccine this year. So again, just to close, wish you all a happy Halloween and safe trick-or-treating. And with that, Kathy, I'll turn it over to you for the question period.
Thank you, Minister. For the benefit of our speakers, we have 4 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any further questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Peter Cowan of CBC News. Please go ahead.
Thank you. Dr. Fitzgerald, can you explain the rationale behind the change in testing criteria?
Sure. So basically, we looked at, the more common symptoms with COVID-19. We also looked at those symptoms which would be more concerning with regard to a diagnosis of COVID-19, so more closely correlated with a diagnosis of COVID-19. And certainly cough and fever are 2 of those symptoms that are a little would raise our suspicion a little bit more and would be more closely correlated with being with a diagnosis of COVID-19. Of course, cough and fever can be associated with other viruses as well, including influenza, which again is a reason to stay home. So, so we certainly felt that we needed to look at it more in a 2-tiered system, where the other symptoms would be could be associated with COVID-19 as well, but not as tightly associated, and could be just as likely or more likely to be associated with other viruses. And so we felt you needed to have 2 of those in order to maintain a good threshold for testing, as well as making sure we're not overwhelming our testing capacity.
And on the topic of Halloween, a lot of the focus has been on trick-or-treating and the guidelines around that. Lots of adults also like to celebrate Halloween, and traditionally this weekend would be Mardi Gras in St. John's, where people would go down to bars and gather together. So what are you expecting that people should keep in mind when they're making decisions about adult parties in and around Halloween?
Yeah, so as we said many times, people, space, time, and place. You should look at where you're going. If you're going to go to a party, is it going to be? Are there going to be a lot of people there? People you don't normally hang out with, people that you may not know. You're going to have close contact with. Are you going to be in an enclosed space? Is it going to be crowded? Is there going to be enough space for you to be able to physically distance? And how long are you going to be there? If you're going to be there an extended period of time, obviously, the longer you're in a place, the more likely there is for contracting or spreading COVID-19. So you need to consider all of those things, but also, remember that you need to wear masks when you're up and moving about. And with regard to downtown, obviously, we expect that the rules that are in place, the guidance that is in place with regard to safe operation of those facilities will still be in place and expected to be followed. And I'm sure there will be a close eye kept on things this weekend.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I have a question in regards to the travel-related cases. With a lot of them, we're receiving the travel advisories in regards to flights, most of them coming from out of province and traveling to Deer Lake or St. John's. Has there been any documented cases of COVID spread on flights arriving in the province? Any spread of them on aircraft?
So for us, for people arriving here in the province, no, we haven't had any documented cases of COVID-19 contracted, for people who have contacted us as a result of a flight advisory that we are aware of. So it does not appear that that's the case here. We know that, in general, the risk is lower on airplanes, or not lower, but we haven't seen a whole lot of cases that have resulted from airline travel itself. There have been some questions as to whether or not that could be a reason for the spread of some cases of COVID-19 elsewhere in the country. But it's often difficult to tease out because not only are people on a plane, but they're also in airports, and sometimes they may be in crowded areas before they get on those planes. So it's sometimes very difficult to tease out exactly where someone may have contracted the virus during an extended period of travel, especially.
For sure, thank you. And also, the question is somewhat in regards to the rotational worker pilot project, but in speaking to a man, he has property here but lives in Alberta. He shares custody with his son, and he usually comes back for 18 to 30 days. He's an emergency service worker but can't be deemed a rotational worker to reduce the self-isolation time. Is the province looking at expanding the pilot project to include some of these individuals who are coming back to visit with family because that they share custody?
So I'm not sure I get the question. Are you asking like people who share custody? I mean, they're allowed to come back, but with regard to self-isolation, the rules still have to apply. And are you asking in particular, is this person a rotational worker, or if this person is a rotational worker? I'm not sure.
Well, they're saying that they travel for emergency services, but they're not given that rotational worker status because that they don't actually reside in the province, even though they do own property in the province. And so for them to return for 2 weeks or 3 weeks, self-isolate for the full 2, travel time, they're really only getting 2-3 days with their child.
Oh, I see. So I guess every case has to be looked at individually, and we have had people who've asked for special consideration with regard to self-isolation. The rotational worker definition does apply to workers in the province, and I don't anticipate that will be changing anytime soon. So certainly, there's always room to have things considered on a case-by-case basis. But the success of our self-isolation policy, I think, is proven, and it would have to be a pretty compelling case to allow somebody to not have to do that. Sorry, I misunderstood your question there initially.
No, it's okay. It wasn't properly worded to begin with, but thank you.
Yeah.
Kathy, are you still there? I think we have some technical difficulties. Does anybody know who was next on the list? Is there anybody able to hear us and respond? I think we may have lost our audio input. Well, for those of you who can still hear us and see us, we don't appear to have any further contact with media currently. I apologize for the technical issues. So I think we'll probably have to wrap this up today, and we can take this up later. Anybody who has any media questions, I would direct you to Ms. Dix-Payton's landline, and the number is available on the media release. So once again, sorry about the technical issues. We'll call it a wrap now. Thank you.